Steve Flowers was basically reiterating Alpha's talking points about how this is supposed to help the farmers. I'm not sure how it helps the farmer if they get denied coverage, but that's another question.
Adam, one of the calls was about a bill that's down in Montgomery, and there are some other bills around kind of health care and like Medicaid expansion light. You went down to Montgomery last week to talk to legislators about some of these different ideas that are floating around. So can you give us just a brief on kind of the Alpha bill versus the Blue Cross Blue Shield initiative and like what's going on and what does it all mean for folks in Alabama?
Sure, yeah. So I was really pleased and enjoyed my experience going to Montgomery this past week with the Cover Alabama Coalition. It's a coalition of well over 100 groups fighting for Medicaid expansion and for, better health care for Alabamians, period. And so it was a good event. There was about 100 folks in attendance, and we all were there to talk to legislators, both primarily in the state Senate, but also in the state House, and talk to them about a couple of important issues when it comes to health care. First, the national context is obviously that Medicaid is facing some severe cuts, which is a threat to really all of us across the South, across Alabama, across the country. Particularly the most vulnerable folks, children, the disabled, elderly, who really do rely on Medicaid. But that said, there's still a lot of work to be done at the state level because we have a healthcare crisis in the state of Alabama. Hospitals, particularly in rural areas, are closing. We've had several close over the last decade, and many more, over a dozen more, are actually at risk of closure, like immediate risk of closure. So it's a really, that's troubling in itself. But we have about 200,000 folks who are caught in the healthcare coverage gap. They make too much money to qualify for Medicaid, as strict as it is in this state, but not enough to actually get private health care. And these are over half of the people in this healthcare coverage gap are working, right? These are folks who maybe cook your food, clean your offices, cut your hair, right? A lot of folks in the service industry and other industries where their pay is not good and benefits are lacking. And Alabama is one of 10 states across the country that did not expand Medicaid after the Affordable Care Act. And I should note that of those 40 states that expanded Medicaid, not a single one has gone backwards, right? Because what it would do for the state of Alabama is bring billions of federal dollars into our state. It would create tens of thousands of jobs. It would help save our hospitals. And more importantly, it would save people's lives, right? We have about 200,000 of our neighbors suffering needlessly without health care, and we could fix this with Medicaid expansion. There's, some pushback from lawmakers in Montgomery over the years arguing, well, how are we going to pay for it? And the truth is, study after study has demonstrated that it would actually pay for itself, particularly when you factor in the federal subsidies and what's on offer from the federal government via taxes that we have all already paid into, right? So Alabamians are paying federal taxes, and folks in Arkansas and North Carolina and Michigan and California, they're benefiting from this program, and we're not. So we were there to talk about that issue and talk about Medicaid expansion with lawmakers. And one of the other big issues going on right now is Senate Bill 84. It is a bill that is being pushed primarily by the Farmers Federation, Alpha Insurance, which is a very powerful special interest in this state. And according to, the American Cancer Society Action Network, according to Cover Alabama and others who have looked at this bill, basically it would legalize unregulated, unreliable junk healthcare plans, not real health insurance. It's not regulated by the ACA. and therefore they do not have to follow those rules when it comes to pre-existing conditions or, actually following through for you when you need help. So there is a big push to get this plan or this bill through SB 84. And there's been a lot of chatter in the media because Blue Cross Blue Shield is opposed to this plan. All right. And it's, we can draw our own conclusions on why. But it's been interesting to see these two very powerful, special interests in the state of Alabama, Blue Cross Blue Shield and Alpha Insurance, going head to head. And they've been battling in the op-ed pages. I saw an op-ed from Steve Flowers that was published in a lot of newspapers recently, where he was basically reiterating Alpha's talking points about how, this is supposed to help the farmers. I'm not sure how it helps the farmer if they get denied coverage, but that's another question.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
Blue Cross and Alpha have been feuding publicly over this bill. And I guess the other thing that you did mention is Blue Cross Blue Shield had come out with a plan that was similar to Medicaid expansion, but basically it would do a similar thing in terms of expanding health care, but rather than those folks going on Medicaid, many of them would go on Blue Cross Blue Shield plans that would be subsidized with these dollars. So it's a private public hybrid plan, and they were trying to make traction on that in recent months. Haven't heard a whole lot about it. It's been pretty quiet. So, me personally, I think I'm going to continue beating the drum for Medicaid expansion because I think it's the easy solution to help a whole lot of our neighbors while growing our economy from the bottom up. And we really can't afford not to do it. And the last thing I'll say on it was, we hear a lot about mental illness and mental health. And, I talk to people in the community all the time, and they bring up mental health and how many folks are struggling with mental illnesses and substance use disorders, and how few options there are in the state for help. People don't have a lot of opportunities for help. And I did some quick Google math, just looking at basically how many folks have mental illnesses, how many folks in Alabama specifically, and then, how many folks of those don't have health care. And it's tens of thousands. Tens of thousands of people are out here with untreated mental illnesses because they don't have health care. They're caught in this coverage gap, right? So, whatever. Maternal and infant health is another area that has been really, really devastated by our lack of Medicaid expansion. We have pregnant mothers who are driving 50, 60 miles or more just to get the health care they need. Most of our listeners know that Alabama ranks at or near the bottom of maternal and infant health care statistics. So, of course, this is a state that proclaims to be pro-family, pro-child, pro-baby. All the politicians, tell us that pretty regularly, especially every 4 years. So, it's interesting to see the conversations around health in the state legislature. I will say that I did not have a chance to speak to my senator personally because there was a long line of lobbyists waiting to see him. And so I couldn't get in. I definitely left a note, left my number, all that good stuff. But I do want to encourage folks, however you feel about these bills or, the one that we had the call about earlier, HB4, the library bill, whatever you think about any of these issues, do stay in contact with your legislators because they are hearing from very special interests, very powerful, wealthy forces in the state, right? They hear from them all the time. It's important that they hear from their actual constituents. Are they always going to listen to you? No, right? Because we recognize who these folks are accountable to often and who put them in office typically. And we recognize some of their ideologies. But it is really important to advocate for what's important to you and to your community and your interest and your family's interests. When you see legislation out there that you think is harmful, it's important to speak up, and vice versa. When you see legislation out there that can help people, speak up. Let your lawmakers know that it's important to you. It only takes a few minutes to make that phone call or to send that email. I really do encourage folks to do that. It's worth your time. And if you can build a relationship with your lawmaker, try to. But if nothing else, do stay in communication with them. Let them know what's important to you, because they're hearing from folks that are a lot more powerful and richer than we are. But ultimately, it's we working class folks who are the majority. We are the majority of their constituents. We are the majority of the taxpayers. And so it's important that they hear from us.
Yep. Yeah, absolutely. Appreciate that update. And, you know, you mentioned I kind of doubt that anything is going to be happening this session just because of all the uncertainty in D.C. You know, the House and the Senate in D.C. both passed dueling budget resolutions last week that are very, very concerning. This is just, you know, it is just the first step. It's a budget resolution. There's not even provision for any cuts or expenditures basically at all. It you know, says it sets a goal of, you know, hundreds of billions of dollars in tax cuts and hundreds of billions of dollars in spending cuts, and then directs the different you know, committees to try to find those. But, you know, the reality is that the on the scale of the spending cuts that they're talking about, you cannot cut that much without cutting into Medicaid. And so you know, it's going to be difficult to find all of those without hurting a lot of people, and that's what's going to happen. So we'll see what happens in DC and what happens in Montgomery.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.